today, and this meeting is being recorded. And then we'll get to questions. I think it's just me on today. It's going to be my last press briefing as health officer. Today is my last day in the office during a weekday, and on Monday we'll hand over those duties will pass to Lori Christensen as interim health officer. But I'll start by trying to share the right screen with you. Sorry. Okay. So here you see the health officer or the surveillance report for this week. We're down to our rolling 7-day average is down to a little under 4 cases per 100,000. That's a decrease from last week. Again, I really regard this as pretty much consistent with what we've seen the last 2 or 3 weeks. Having that low number of cases is what we've been looking for months and months. It's good news. We're also seeing a decrease in our positivity rate. The number of tests that we're seeing happening in the county has decreased. So you want to look at that positivity rate, and the fact that it continues to be stable or even go down is an indication that we're not missing a whole bunch of cases somehow. Lower testing often means there's just fewer people who are sick and seeking out testing, but you want to sort of test that assumption with this positivity rate. And we're seeing that now below 5%, which is where you want to see it. Testing is fine. We're getting test results back. There have been some blips based mainly in reporting of negatives. We're getting the positives faxed to us, so we're not missing positives, but there's been some delay sometimes in some of the negative test results that we get. That's not a big problem for us. And generally speaking, we're getting people tested and we're getting those results back lickety split. That's allowing us, that the number of days, most of our results are coming back to us within a day, and we're getting, with the staffing we have now, we're able to get those case investigations started within sometimes the same day we're getting them. You can see the onset date. You can see you're just seeing fewer people because we have fewer cases. We're seeing fewer people reporting illness. The age breakdown hasn't changed much with the low number of cases we've had. Not really much to talk about there. Same with MSU. We're not seeing cases in MSU right now. That's not surprising. We are seeing some school-related cases, but overall a pretty healthy surveillance report for this past week. It's what we really wanted to see. Before we get into questions, I just wanted to make sure to thank all of you. I know that this pandemic has been hard on everybody. And speaking as a health officer, I can sympathize with people who aren't always super appreciated by everybody in the world. And I want to say that to all you. I know that you've had a tough job, and I want to thank you for everything you've done and taking the time to hear our message and to report it and to get it out there. So thank you all. And I also want to acknowledge and call out the help and partnership that we've had from our communications team, led by Whitney Burmis on this call. Whitney doesn't work for the health department. She didn't really have to be as engaged on this stuff, certainly as she has been over the past year and a half. And her, along with Melody Millier from the city, along with Holly from who's now on our staff, they've been champs and have really helped me survive this past year and a half. And then I finally want to just let you know, you're all in good hands. Lori Christensen takes over as interim, and I'm hopeful and expecting that she'll be approved as the full-time permanent health officer starting on Tuesday once the commissions meet. Lori has been an incredible partner to me, and you're in good hands. She's smart, she's patient, more patient than me, And she gets stuff done, and she does what she says she's going to do. So I'm really feel good about the fact that it's hard to leave. I'm sad to leave, but to be able to pass it off to somebody as capable and professional and smart as Lori really makes me feel better about it. So with that, I'll open it up to questions.
Hey, Matt, Nora with the Chronicle.
Hi, Nora.
Hey, I was wondering if you could talk about, kind of the timing of your departure from the department, kind of considering where we're at with numbers and vaccination rates in the county.
Yeah, I mean, it was when this possibility came about a few months ago, I really struggled with the idea of leaving because we were still seeing a lot of cases. We were still in the middle of our vaccination effort. And so the thought of leaving was difficult. At the same time, I could see where I thought we were headed. And so it's a relief, frankly, to be able to get to this point when I'm about to go off and do different things. I'll still be in public health. I'll still be in Gallatin County, and I'll still be working with local health departments. But to be able to hand it off and to be able to give our staff a little bit of relief, to normalize things within our own operations is a huge relief. It's and that's not to say we're done. We are not. It's not going to be too long before we have cold season hit, before we have MSU students coming back to school season, influenza season, and it's going to be really important we keep getting those shots in arms. We are at, looks like we've got about 59% of the population, of the eligible population, has at least one dose. And we've got 48% fully vaccinated, according to our most recent numbers. But that means we have a ways to go. We have a real opportunity here. We've had some things break in our favor recently. Number one, we have a lot of people who have gotten vaccinated. The weather has warmed up and people have gone outside. We've had quite a few people in their 20s leave the community. And so we have fewer people in that age category, which was really helping to drive some of our numbers. So there's things working in our favor, but everything rebounds. And so it's going to get cold again, believe it or not, in Montana. We're going to have, many thousands of young people come back into town. Influenza season is going to hit. Kids are going to go back to K-12 schools. And so the good news is we have those shots. We have the vaccine. And so, as I've been saying, the fastest way back to normal, the best way back to normal is by getting the vaccine. And that goes for individuals as well as the community. And so I think that's going to be important. Did I answer your question, Nora?
Yes, you did. Thanks. And the second thing I wanted to ask you was, I'm wondering about like the partnerships between the health department and MSU and Bozeman Health in the city and that sort of things. It seems like that's been really strong during the pandemic. So I was wondering if you could speak to that and kind of where you leave that.
Yeah, I think what not a lot of people know what is absolutely the case is that the planning for a pandemic started years before we actually had a pandemic. We actually had meetings with what we call the Unified Health Committee dating back prior to the pandemic, where we were talking about unified incident command. We were talking about bringing in an incident commander from outside of our organizations to help. It was hard to visualize at that point in time. I'll call out, people on our team, Betty Caliquet, our emergency preparedness coordinator, Patrick Lonergan over at emergency management, he and his team have been so critically, not just helpful, but absolutely an integral part of our team. But well before the pandemic, we were talking about how to deal with a pandemic before we even knew the bug we were going to be dealing with. And so that work included Bozeman Health, it included MSU, it included the fire departments. It was hard. That's hard work to do sometimes because you don't really know what you're going to be dealing with in the theoretical. But it helped us build those relationships and to make those connections so that when we did start to have a pandemic, we weren't introducing ourselves to one another. We knew each other and we had planned for it, and we we had developed capacity for it. Does that mean it was easy? Nope, it was hard. And did it turn out exactly the way we envisioned it? Nope. There was a lot of things that we had to change about it. But having those partnerships was critical. You know, I will say that I won't start naming people, but our partnerships with MSU, with Bozeman Health. I mean, the health department and Bozeman Health have kind of been in a friendly competition to see who can give the most shots. And we've given almost exactly the same number of shots over the past since December. And so I want to say thank you to all of them. Chief Grube at Hebgen Basin Fire District, man, let me tell you, somebody who's gone above and beyond. He's given shots consistently, run pods out there, community health partners, helping us reach into organizations and into populations that are harder to reach. They've been pretty critical, and just know that those relationships existed before the pandemic, and I'm confident they'll endure after the pandemic. And they're not reliant on one person like me. It really is about the system, and I just give a lot of credit to the people who work in that system for making that happen.
Okay, thank you.
Mm-hmm. Other questions?
Hey, I'm the new reporter at the Chronicle. I had a quick question just about these weekly meetings with cases just continually going down. If these press conferences are going to stop anytime soon, or if Lori's going to keep doing them in perpetuity forever.
Do you want them to stop?
Nope, but I'm just
Okay.
kind of curious when that benchmark.
That'll be up
to. We don't do it anymore.
I think that'll be up to Lori, and it'll be up to what the demands of the situation are. I would imagine that she will take the opportunity to have these. They may be less frequent. I'll leave that decision up to her, and it'll be driven in part by what we were seeing in the epidemiology. I don't think she's going to want to come and tell you the same thing over and over again, week after week. But if there's real information to share, and you guys know our culture is built on being accessible, we try to make sure that we're accessible to everybody. And so part of this is it's just easier. It's more expedient for us to talk to you all at once. But it might be that we get to a point where it makes more sense to do those in one-off. So no firm decision on that. I would imagine this won't be the last press briefing that you'll get from the health department, but exactly what those will look like in the future is to be determined.
And also, just as the email notes, Holly Whaley will be the media contact for the health department moving forward. So you can contact her anytime if you have questions or need to talk to someone in the health department. I'm also not going anywhere, so you can always call or text me too. So you've got plenty of options, even if this press call isn't going to be on a regular basis.
Cody, I think you were trying to ask a question, but you were muted. So
I was muted hard. I forgot the button after all this time. You think we know by now. Well, just swinging into it, and that's kind of like my really sloppy segue into what we talked about. I think it was back in March or February when we had that long sit down, you and I. One of the first things that you mentioned to me was I asked how many years you'd been there, and you said 10, 11 going on March, and then mentioned this last year and a half feeling like a decade for understandable reason. What's the feeling now, this last day of press conference with us, meeting? You mentioned it a little bit before, but just, it's a big step.
Yeah, it's difficult to leave a job. I feel pretty lucky. I know, from the outside, particularly this past 15 months, looking in, this doesn't look like the easiest job, and it hasn't been the easiest job. And sometimes it's been contentious and it's been hard and impossible to please everybody. That's not what the job is about. And so it's bittersweet. I'm really excited to be able to hand off to Lori. She is a consummate professional. She's worked in multiple parts of the health department. She has a master's in public health. She's a registered sanitarian, which is really important to our work as well. So, I've been honored to have the position. I've tried really hard to serve the community every day. in the best way I can. And sometimes that meant making, especially the last 15 months, meant making some really hard decisions that we knew were going to make somebody unhappy. No matter what we decided, there were going to be significant numbers of people who were unhappy and weren't going to think very highly of the decision. But we just tried to make the right decision, and we tried to do the right thing. And in some ways, when you know you're going to make somebody mad, what you just try to do is what you think is right. And so that's what we tried to do. That's been hard. It's I wouldn't have gotten through it without our staff. And when I think about that, I talk about that in terms of the incident. I think about that in terms of the incident command. Boy, the health department staff, I'm not going to start naming them because I have to name every single darn one of them. And I don't want to do that. I just want them to know if they're out there listening. I couldn't have done it without them. I wouldn't have survived. The Board of Health has been stalwart. The county attorney has been, Marty Lambert has been an enormous partner. Patrick Lonergan at emergency management, our director of emergency management, is a huge asset. Mike Multiverne at Bozeman Fire Department, and then a number of other organizations. And so as I think back on that and I think about that, I'm really proud too about the quality of the staff that we have here. I've spent the first 10 years working with my colleagues here to really build our team. And then over the last 15 months, we got a chance to really use that team in the biggest public health crisis that any of us have ever seen. And then we were also able to use those partnerships that we had developed in the community with Bozeman Health, with emergency managers, with the fire departments, with HRDC. I mean, HRDC has been just incredible in terms of helping us provide housing, helping us provide outreach to people who are hard to reach. Heather Grenier at HRDC finds a way to yes almost every time we ask. And I can't tell you how difficult that is and how much we appreciate it. So my feelings leaving are, I'm going to miss the crew. I'm going to miss the work, but I'm really excited for my next step. And I'm really excited to see Lori step into this role.
And you mentioned challenges before too, going into those. I know you may argue against it. It's big shoes to fill for anybody to fill in a health officer after a decade of work, especially after a year and a half for sure. What are some of these challenges and lots of moving parts with changing legislation? What are some of the challenges that she's going to have to charge into?
Well, I think there's a couple of pieces to that. One is not necessarily Lori doing it. It's going to be the Board of Health and the commissions figuring out how to deal with the legislation that came from the legislature with Board of Health authority. And the bottom line that I want people to remember and understand is that even with all the changes, and the changes were substantial and significant, but even with all those changes, if you look at the Montana state law, Montana code, and I would refer you to MCA 50-2-116. When you look at that, the responsibility, the duty to take actions to address public health issues continues to rest with local boards of health. And I really hope, and I'm urging the county commission and the city commission, and I think in the future the Belgrade City Commission, to really continue to acknowledge that and to empower the board to continue to do that work, because it is their responsibility. It's not a responsibility that rests with the commissions. It's not a responsibility that rests with the county administrator or the city administrator or anybody else. It's a responsibility that rests with the Board of Health. And I think finding the way to continue to have a strong, empowered Board of Health that oversees the health officer and the health department is going to be a huge need. And I think it's totally doable. Now, turning toward the health officer and the work of the department, I think we have a real opportunity. We have right now, what did I say? 59% of people with one dose who are eligible with one dose. As we move to the fall, I would love to see that number move towards 70%. And I would love to see the age bracket of people who are eligible come down. And then that's going to create some need to continue to get those doses in arms, because if we do that, that really gives us our best chance to maintain that more normal stance that we're in overall. So that's kind of, from a pandemic perspective, I think vaccines are going to be, the need to administer vaccines is going to be important, to communicate clearly with the public and to respond. We're at a point now where when we see cases, we can kind of put out those spot fires, and that's good. If you look beyond COVID, I mean, we have major challenges like every community in the state of Montana with our behavioral health system. I think that the health officer and the entire community have a lot of work to do to continue to build our public mental health system in a way that serves everybody in a significant way. And I think there's a lot of attention that has been focused on one particular area, the inpatient area. But I would say from cradle to grave, we can do a better job of providing behavioral health services that keep people out of crisis. And we just don't have that system yet. And it's not just this community, it's statewide, it's frankly nationwide. And I think that when we look at our community health assessment, when we look at our community health improvement plan, that behavioral health system is going to be front and center in the work that we need to be doing. And not all of that is going to be in the purview of the health department, but it certainly is part of it. And I think especially in those areas where we can build the capacity of our community to better care for and provide resources for families of young children so that they don't, when they have those behavioral health needs, we're addressing them early before they have needs for things that are more expensive and more difficult for them and their families. And then I think the other area is chronic disease. We've really focused on communicable diseases. We've built our skill set and our toolbox to address communicable diseases. But the large burden of premature death and illness in our country, frankly in the world, it has to do with chronic diseases. And those are things like heart disease, pulmonary disease, and those things are addressed by helping people quit smoking, helping people quit vaping, helping people, preventing people from starting that, getting them active, giving them opportunities to be active, finding ways to engineer our built environments so that people can bike and hike and be active. And I think our community is really well positioned for that, but we have some work to do. And so I think those are the areas, if you look at our community health assessment and our community health improvement plan, those are the kind of the big ticket items that, any health department is going to be working on. I think that's going to be part of Lori's work.
Gotcha. Thank you. And my last one, I'm trying to keep mine short because I could go on with you forever. Speaking of community and challenge, in terms of the friction that has gathered over the last year and a half, for some, she's entering that as well. What do you want the public to keep in mind moving forward? It's especially with some things still raising contention in category here and there.
Oh, I think just to know that every day of this pandemic, we were just trying to make decisions that considered the entire community. And we knew that some of those decisions were going to be unpopular with some people. And we knew in some cases those decisions could be economically harmful. And those were the hardest ones, the ones that had to do with business restrictions. I know the mask rule generates a lot of attention, and it's important. But the hardest ones for me were the ones that placed restrictions on businesses. I took those very seriously. Those were really difficult to deal with. And so as we move forward, I'm really glad that we're able to move forward without any of those rules currently in place. And I think we have an opportunity to put that in our rearview mirror for good, especially if people keep getting those vaccines. If we can keep those vaccines going, we really have an opportunity to not have to deal with that again in the future. So that's kind of what I'm thinking.
Good. Thanks, Matt, as always.
Cody. Yep. Other questions? All right. As I said, I, as you all know, I came up as a reporter. I I appreciate your job. I appreciate how tough it is to do your job. I appreciate how tough it is to get a job in your industry, and I want to thank you for your service and let you know I am not going to be around to give comments about the work of the health department. That's not going to be my job anymore. Not because I don't want to, but because I want to respect and honor that somebody else in that job, and it's a darn hard job, and I want to make sure that she has. But I will be working in public health in general. I will be around the community, and I look forward to seeing y'all in the future. Thank you all very much.
Thank
Thanks,
you,
Matt.
Matt.
Thanks, Matt.
Thank you so much, Matt.
Thank you.